Assalamu alaikum, everyone. Welcome to the second episode of Azadar Imam's Health and Wellness Podcast. My name is Hassan Rizvi. I'm a volunteer for AEI Telehealth. And today I'm glad to be joined by one of our chief medical officers, Dr. Ali Jaffery. Dr. Ali, if you want to introduce yourself.
Hello, everybody. My name is Dr. Jaffery. I'm one of the chief medical officers at AEI Telehealth, along with my co-CMO, Dr. Madiha Rizvi. I am a board-certified internal medicine doctor, currently working in the outpatient setting. I have experience in both the inpatient and outpatient settings. Currently based in Virginia, and happy to be doing this podcast today with Hassan.
So today we're speaking with Dr. Ali on how adults and family members can better treat and understand diabetes, support healthy habits, and navigate common myths, specifically around food, culture, and lifestyle. So to start us off, this is a simple question. What is diabetes?
So diabetes is a metabolic disorder, what we call, as we know, type 2 diabetes, which is adult onset diabetes. Typically, it arises from a factor of lifestyle and genetic influences, but I would say mainly lifestyle, which includes diet, especially lack of mobility and exercise. I think are the two main culprits for the development of diabetes. Diabetes essentially, it's a disorder of the pancreas and of the body in general. The pancreas is responsible for secreting insulin in response to glucose consumption. And when you have too much glucose consumption and a sedentary lifestyle, that's usually two key ingredients for the development of diabetes.
So Dr. Ali, I have no clue about anything regarding diabetes. So if you could explain it to me like I was a 5-year-old, that would really help.
So type 2 diabetes is a disease that is a disease of too much sugar in the bloodstream. Too much sugar in the bloodstream has very bad consequences for heart health, for brain health, and for other systems in the body. Um, and so really it comes down to we have an organ called the pancreas, and that releases insulin. That insulin helps put the sugar into the cells where the cells use the sugar. So you don't want the sugar in the bloodstream, you want it in the cells. And when you
Mm.
develop something called insulin resistance, that means you can't get the sugar into the cells, and so there's always too much sugar in the bloodstream. And so that's kind of like the most basic way that I can describe type 2 diabetes. Typically, you want to change this or treat this with a change in diet, a change in lifestyle, and also any medications that your doctor prescribes.
So just getting to the warning signs of diabetes, what are some of the warning signs that blood sugar may be too high or too low? And what should family members be aware of?
Typically, before a formal diagnosis of diabetes, what we see in patients is that we see they may develop excess thirst. They also may develop increased urination, and they will always have the sense that they need to go to the bathroom or they're going to be always hungry. Those are key signs that there's too much glucose in the bloodstream, causing these downstream effects.
So beyond diet, how much do things like sleep, stress, and daily movement matter in diabetes management?
So all three things, sleep, stress, and daily movement are all key components to help prevent the development of type 2 diabetes. I would say sleep, there's recent studies that show that a lack of sleep actually increases insulin resistance. So adults should be aiming to sleep between 7 to 8 hours daily, and they should do that consistently to help prevent the development of diabetes. Another thing, stress. Stress correlates with the development of type 2 diabetes. Stress releases the stress hormone called cortisol, which can help, which increases insulin resistance as well. And also, mobility is also one of the key factors of the development of type 2 diabetes. Exercise, a routine exercise program, as simple as walking daily 30 minutes a day, especially after a carb-rich meal, can help prevent the development of type 2 diabetes.
So in many cultures, foods like rice, bread, or certain fruits are staples. Do these foods really need to be eliminated or so they can be enjoyed?
The issue in modern day medicine and modern day life is that a lot of these products are genetically modified to increase yield. And by doing so, what it does is that these foods have a very high glycemic index, which means that once you consume these foods, they tend to spike the blood sugar in a way that the body's responding um, in a massive way. Typically, the pancreas is not used to historically, releasing lots of insulin at one specific time. But now when we consume things like white rice or white bread, These things that are modified and have been modified, what it does to the insulin, to the pancreas, is that it tells the pancreas, listen, there's an immense amount of glucose within the bloodstream. Let's release all the insulin that we have. And over time, what happens is that the insulin or the pancreas, uh, after releasing all this insulin, it becomes resistant. And so the cells are so used to, as much of this insulin in the body, and they're not able to utilize the insulin as the way that they are normally used to doing. And that leads to insulin resistance.
So I guess that leads to my next question. Are there simple, practical ways families can support balanced meals, especially when carbohydrates are involved?
Yes, I think there's several things that people can do. I think concentrating your heaviest meal as early as you can is the best thing. It's also one of Imam Ali's hadiths that, have breakfast like a king and have dinner like a peasant. I think in today's society, I think we live the opposite life where we have a heavier dinner,
Sure.
especially if we have a carb-laden dinner at bedtime. It's going to spike our insulin, and then we're usually sedentary at nighttime. We go to bed. That leads to consequences that we, don't foresee. Things like the development of type 2 diabetes, obesity, and all the things that come with obesity as well. So um, it's important to prioritize when we eat, and also just consuming less of, what we eat when we do eat it. I think those are really key important factors that will make a dramatic difference in somebody's life with type 2 diabetes.
Absolutely. So we want to do this episode especially for people who have loved ones with diabetes and how they can support them. We know that a lot of the South Asian community don't really care about their symptoms. Um, so what are some complications or some long-term complications of type 2 diabetes?
So the complications of diabetes or type 2 diabetes specifically can be broken down into macrovascular and microvascular complications. When we talk about macrovascular complications, we talk about things like the development of heart disease or early heart disease, strokes, are kind of two of the main macrovascular complications, meaning the big vessels in the bloodstream get affected with high glucose levels, and there's kind of an early development of plaque buildup, or atherosclerosis is what we call it in the medical community. Um, these things correlate with heart attacks and strokes. And so those are the macrovascular complications. When we talk about the microvascular complications, we talk about the smaller blood vessels in our body called the capillaries, which are found at the ends of the feet and the fingers. Um, those can cause things like ulcerations if there's if there's long-standing uncontrolled high blood glucose levels, ulcerations, diabetic neuropathy, what we call basically numbness of the feet. That can lead to changes over time where the feet are more prone to getting small nicks and the patient might not notice what's going on. And over time, that can get infected because the blood supply to the area is compromised and there can't be a robust inflammatory response to deal with that infection. So you can see people losing their digits. You can see people with bad infections, gangrene, things like that. And
So,
also, I can't forget diabetic retinopathy. So also, like I said, it affects the nerves too. One of the main nerves that it affects is the optic nerve in the eye, which affects the vision. And so that's something that is a frequently occurring side effect of diabetes.
so you mentioned all these symptoms and these side effects, but what if your patient is like non-compliant? Like how would you deal with that?
Yeah, so usually when there's a non-compliant patient, there's a lack of understanding of what the disease does and lack of understanding this or lack of education about the disease in general. So my first approach would be to educate them as much as I could. Also to get understanding of what their own understanding of their diabetes is, so I can kind of meet them where they are and then educate them from that point on. Also, I think it matters like, people may have had their parents or grandparents or uncles, aunts that they have seen live with diabetes. And, if you come from a society where the expectation is that you'll just get diabetes and you'll die when you're 65 of a heart attack, then that's what they think life is about. And they have no other aspirations beyond that. And so I think education is really important and helping them understand that, no, listen, this could be treated. And once it's treated, you can live a longer lifespan that's healthier, and it's as simple as that.
So then, speaking of education, how would like what's the best way to educate? For example, I'm a son with a parent who has diabetes. What's the best way I can educate my parent about how they can live with diabetes?
So I think the first thing is making sure they have a provider, or like a doctor that they trust, that they can go to and seek advice from. Also, the family might also not understand the complications or the effects of diabetes, and so I think you can educate yourselves together and kind of learn about what's going on, and maybe you can help your parent or your loved one on that journey. You can make healthier habits. You can kind of enforce rules on your parent that, listen, like this is what we're going to be doing because this is healthier for you, and you're my dad or my mom. I want you around for as long as I, can. And I think if you have family support, that makes a big difference. And I think they'll be better off for it.
For sure. And we've been talking mainly about type 2 diabetes, but for those who don't know, what's the difference between type 1 and type 2?
So type 1 diabetes is basically usually juvenile onset, a younger onset, where the pancreas itself, earlier this episode, I mentioned the cells in the pancreas that produce the insulin. Type 1 diabetes is actually when the body itself attacks these cells that produce the insulin, and so therefore the patient cannot make any insulin on their own. So it's an autoimmune condition where the body thereby attacks itself and destroys these insulin producing cells within the pancreas. And so from a young age, 7, 8, 9, these patients need to be on insulin therapy. Type 2 diabetes, comparatively, is like I said earlier, it's a metabolic disorder where it's associated with diet, obesity, and things like that. And typically, it's adult onset. So over time, these changes take place. You have high blood glucose levels. The insulin gets released from the pancreas at much higher rates. And at the level of the cell, the insulin helps push the glucose into the cell. But once you get insulin resistance, then you get type 2 diabetes that way.
I guess going back to type 2 diabetes and educating our families, can you construct like an ideal diet for a diabetic, specifically a South Asian diabetic? Because I know a lot of our listeners can relate to that.
Sure. So a lot of the things that I see within the South Asian community is that there is a high consumption of white refined sugars and breads and rice. And so how do we start? What's a good place to start is that we mitigate these things. So we cut out the white refined sugars, we cut out the white breads like the parathas and the white rice, especially later at night. When we consume these big meals later at night, that's almost like, almost guaranteed that you're gonna get diabetes, especially if you have a family history of it. But it all goes back to lifestyle. That's the main thing. And so, like I said earlier, is that it's important for you to have your biggest meal early. If you do want to consume carbs, eat less of the carbs, but eat them earlier in the day. Um, and with each meal, you want to have a sufficient amount of protein. You want to have more protein than carbs, and also fiber too. Both the protein and the fiber will allow your body to help ease into this insulin spike, and it'll help release that sugar from your meal slowly into the bloodstream. And so that's going to be really important. And you want to avoid foods that are high in glycemic index. All the foods that I mentioned earlier are high glycemic index foods. What's a glycemic index? Is basically how your body responds to food consumption by releasing sugar. So foods that are high in glycemic index, that means that the body responds by producing a lot of insulin. So that means your body thinks there's a lot of sugar in the body. And so it's pretty easy to just Google, well, high glycemic index foods. You want to avoid those. You want to stick with foods that are more low glycemic index. You want to use a flour that's not refined, not white. You want to use more like I guess you want to say the older type of flours that comes from like the whole wheat grain. Einkorn is one example of that.
And then I guess we know sugar is such a big thing and a big ingredient for South Asian families. Do we have to cut it out entirely, or can we work our way around it?
So, like I said, you want to avoid things with any added sugar, especially like white refined unadded, like added sugar and like the teas and things like that. We can look for alternative type of sweeteners. Typically, honey is good, but you still want to consume it in less quantity. Stevia, which is a plant-based sweetener, is also good. Um, and like I said, it's kind of a more of a metabolic condition where we have a lot of inflammation that leads to this insulin resistance also. So you want to kind of eat foods that are anti-inflammatory. That's going to help you manage your sugars too. And like I said, a bigger meal at breakfast and the smallest meal of your day at dinner is going to be important. You want to avoid the white breads like the parathas, the breads, things like that, the rotis. Consume much less of that. Maybe if you're eating two of them, eat half of one. And more protein is going to be key.
Yeah, so you mentioned anti-inflammatory foods. Off the top of your head, can you think of any anti-inflammatory foods that are already we already consume within the South Asian community, or are there
Sure.
some that you think we should implement?
So I think really any fruit's going to have anti-inflammatory benefits. Different herbs like turmeric is a potent anti-inflammatory. So adding that into our diet, and this, turmeric is a basic ingredient in many of our food. Um, and so different fruits, you do want to avoid certain fruits because certain fruits are higher in glycemic index, but most fruit like berries will be excellent choices to have. Um, Things like that, I think, are kind of simple things we can add into our diet.
And we know, like, if, like I mentioned earlier, if we're trying to help out a loved one with diabetes, we know these conversations can be really sensitive. So how can like children or adult children like really engage with healthier habits without causing tension with their parents?
I think it depends on everybody's personal relationship. I think everybody has a different relationship with their parents, and how to navigate that. I think the children will know best. The adult children will know best. But I think just being supportive. I think diabetes is a condition that is debilitating over time, especially if you've had it for a while, and it's kind of led to complications, different heart disease. People have had heart attacks, strokes. And so you want to come from a standpoint where you're supportive and understanding and not criticizing. I think criticizing, in any advice that people give, I think want to be supportive. You want to come from a place that's a good place, and so people could be receptive to your advice and help. And so I think planning meals, helping them in that process. I think you can play a big role in that.
And you mentioned, things like heart attacks and strokes. Let's say, we see someone with symptoms of, that could lead down to a heart attack or a stroke. What are signs that should be indicators that someone should seek medical attention sooner rather than later?
Sure. Yeah. So typically, the development of heart disease is a long process that takes years and decades. And so if somebody has a high sugar or has had high sugars for many years, they're always at risk for developing earlier heart disease. Some signs you want to look for is called angina or chest pain, whether that's at rest, which is more concerning, or if it's with activity, that means there's a lack of adequate blood supply going into the heart. And when the heart works harder, when you're moving around, there's less blood supply that matches that, and so you can develop chest pain, shortness of breath, things like that are, I think, the more common manifestations of heart disease.
Okay. And because we are AEI Telehealth, I guess I want to shift towards telehealth. So how can we use tools like telehealth, maybe glucose monitors, health apps to help our loved ones stay engaged and informed with their diabetes?
Sure. So nowadays, this technology with it advancing, there are sensors that we can use. So if people are don't like finger sticking themselves every day to check their blood sugars, they can wear a sensor that they can buy for maybe $100 a month, from online without the prescription, or you can get a prescription one also. But you can get these and you can wear it, and you can, if you're curious and you want to learn and you want to see what foods cause these spikes in your sugars, you can kind of see, let's say after breakfast you had some, higher carbs. You can see what that does to your sugar, and so you can learn, what foods to avoid, and what foods are good for you and your sugar. Um, and telehealth, I think nowadays, most doctors and most places are utilizing telehealth. It's a convenient way to get in touch with a medical professional or even a dietitian that can help you guide to better food choices and can help you on your journey with type 2 diabetes.
So you've seen quite a few patients for us at our clinics in Iraq and Pakistan, but what are some common problems with diabetes that you've seen there? And how can people in these communities that have limited resources um, treat their diabetes?
Yeah, I think one of the common problems that have seen with patients in Iraq and Pakistan, and also as patients here, also just consumption of carbs. A majority of their caloric content or what they eat is coming from carbs, and so that is a place where we can pretty easily intervene and tell them, listen, that you need to really cut back on the amount of carbs you're eating. Replace those calories with some protein or some other fiber intake like fruits and vegetables, and I think just with that, you'll see a significant improvement in their glucose levels. The carbs that I'm talking about refer to white bread, white rice, and white sugar. So I think the way that these people can, that obviously come from not as well backgrounds as we are here in the West, And so it's not complicated to treat diabetes in the sense that, what do we do in terms of a dietary perspective? And so what do we need to avoid in our diet? And that goes back to what I said about eating less carbohydrates or eating less of the white rice, the white grains, or the white breads, and incorporate more proteins. But also after each meal, you want to go for like a 30-minute walk to help blunt that glucose spike that happens after each meal. Walking leads to independent insulin, independent uptake of glucose into cells. So that means your body doesn't need to use insulin to get the glucose into cells where it actually is needed. And so by walking, you can actually get more of this glucose out of your bloodstream, especially after a meal.
I didn't know that.
Yeah.
So I guess on top of walking and exercise, um, these people that have limited resources and limited access to equipment, what can they do for exercise? I know you said walking, but can you think of anything else?
Yeah, when you're walking, you ideally want to go for a brisk walk. So, walk at a fast pace. That's shown to reduce cardiovascular events pretty significantly. Even without any fancy, workout or gym equipment, you can do push-ups, you can do sit-ups. Anything that gets your blood pumping is good. And so, even jogging in place, doing jumping jacks, and just simple just body movements, I think makes a difference.
All right, so aside from diet and the importance it has, how important is medication in the role of diabetes?
So at the initial diagnosis, I think medication is really important because it'll take time for the patient who has been living their life a certain way for, an X amount of time. It'll take them time to develop and change their lifestyle habits. And so medication plays an important role, I think initially and throughout their course of diabetes. And so I think it's individualized to each person how bad their diabetes is, like what their sugars are at the time of diagnosis, and then that kind of will dictate what medications they'll need and how much of that they'll need. Once you get to that point, you work with them on changes in terms of their dietary changes and see how motivated they are to make those changes. And if they do, I think they'll see a significant reduction while they're taking their medication. And then at that point, you can, if they're a good patient, you can maybe consider scaling back their medications to see how their sugar responds, because it also depends on at what stage of their diabetes are they diagnosed. Are they kind of late stage where their body's been dealing with high sugars for a long period of time, the pancreas is tired, there's not as much insulin being produced now because of that reason, and so I think those patients will end up needing more medication or just medication for the duration of their life, versus somebody who's diagnosed earlier, their pancreas is still not as tired, and so they can take medications for a short time while they make these changes, and then kind of see if they can reduce those medications later on. So medications play a crucial role, but I think the fundamental treatment or the approach for diabetes should always be addressing the diet and see if they can reduce those carbs in their diet, and that will make a dramatic impact.
So I guess staying on topic of that, a lot of people in our community just, they'll take the medication and they think they can eat whatever they want. Is that true?
It's not true because the medication helps your body kind of support the body in dealing with the sugar in your body, right? And so, like I said, the pancreas is still the main organ that produces the insulin, and that's addressing the insulin. The medications that we take either help support that or do something else in the body that can help reduce the amount of sugar being produced. But at the end of the day, it's still the diet that I think will be the main factor. If they don't control their diet, they're still going to get these high spikes in their insulin. It's going to lead to insulin resistance. If they're overweight and they don't lose weight, that'll lead to insulin resistance. And I think all those things will actually progress their diabetes, and they'll end up needing more medication in the future. It's a snapshot in time. It's a progression, and so I think what'll happen is that maybe 5, 10 years down the line, they're on, let's say, one or two medications. They may end up needing a maximum dose of those medications plus other medications to help control their diabetes.
I guess that was a big misconception that was cleared up. Are there
Mhm.
any other misconceptions that you've seen within our communities that you want to clear up as well?
I think there's always, I would say those are the main ones, but I think, people sometimes think that, oh, it's genetic. So because my dad had diabetes, I'm just bound to get it, which is actually not true at all. Like I said before, diabetes is primarily a lifestyle disorder and a metabolic disorder. And so if you eat healthy, if you do the right things, and if avoid the things you should be avoiding, then you don't have to get diabetes just because your dad had it. I think within the South Asian community, I think everybody lives a certain type of lifestyle, which is why people are prone to getting diabetes. But I think coming out of here in the West, I think the generation that you and I are part of, I think we live a little bit different lifestyle than our parents did. And so, because of that, I think we'll see much less rates of type 2 diabetes in our generation living here, even though we're South Asian.
Yeah, and I guess speaking of genetics, a question someone had asked on our Instagram was, what
Sure.
role does family inheritance play in diabetes, and does it have any effect at all?
It does have an effect, but not as much, like I said, as lifestyle. Lifestyle is the main thing. There are certain, genetic things that do happen in the background, in terms of like how resistant your cells can become to insulin and things like that. But lifestyle still is the primary thing. So you're not guaranteed to get, it's not a lost cause that if your parents or mom and dad, grandparents had diabetes, that you also will get it. There's a lot that you can do that can influence your own personal outcome. Taking care of yourself and not engaging in heavy carbs, eating late dinners, things like that. So you are in control of your destiny with type 2 diabetes.
Well, there's hope for me. Okay.
There is, yes.
Um, so I guess we've spoken on so many improvements now, and I guess what are some small improvements or everyday, I guess, bits of progress that our families make that we should recognize? Like the
Sure.
small.
Yeah. Yeah, absolutely. I think encouragement and positive enforcement, I think, will go a long way. Any little thing, whether it's like they're consuming less carbs, or they're changing their diet by eating more fiber, or they're more regular and just taking their medications. I think all of that needs to be encouraged and supported, so they don't feel like they're alone in their kind of battle against this disease.
Dr. Ali, thank you so much for joining us today. We really appreciate it. I know I learned a lot. I hope our viewers learned a lot. I think one thing I can definitely take away is the impact of exercise and the fact that we can still live our life, and our parents can live our lives while dealing with diabetes. And I just hope we can continue to break down these stigmas and misconceptions and move towards a better future for not just us, but our families. And Dr. Ali, if you have any closing remarks or just a message for our viewers.
So I just wanted to say thank you for having me on this podcast today. I hope it was an informative podcast. I hope people can learn from it. I certainly did. And so let's keep this conversation going. Let's keep the education going. I think that'll make the biggest difference. Other closing remarks that I have is that, type 2 diabetes is a lifestyle disease. And so with these lifestyle changes, we can make dramatic impacts. And so you don't have to live with this for the rest of your life. As long, you know, Visit your doctor, get diagnosed. If you do have it, get treated with it. Find somebody you trust, and also help us support our clinics in these countries, in Iraq and Pakistan, where diabetes is so prevalent. We can, we help as many people as we can, and there's still a lot more people to help. And so please contribute, and please help us help people.
And on the topic of our clinics, this episode was brought to you by Azadar Imam and AEI Telehealth. Please follow us on Instagram. We'll have our socials somewhere up here. So please check us out. And inshallah, we'll see you guys next time on the Azadar Imam Health and Wellness Podcast.
Thank you.